So we're now joined by Dr Dithinji Gitahi from AMREF Health Africa. Thanks so much indeed for joining us and welcome to the program.
Thank you very much, Nero. Thank you.
All right. So I suppose it's a welcome relief for most Kenyans to see these restrictions lifted. But as someone who works in the medical field, do you think that the timing is right? Are there enough statistics to suggest that it's a good time to ease down, or are you a little concerned?
Well, there's really no right time. I think it's been a very difficult choice for governments, across the world and in Africa specifically, balancing lives and livelihoods. And I think what now has happened is you have to lock down for a particular reason. And I saw that also in South Africa, to say the lockdown doesn't mean that the virus is going away. It just means that you're more prepared for the eventuality when you open. So I guess the president's decision is to open, but he was very clear that the responsibility now shifts to the individuals, because civil responsibility is voluntary. It's people really who have to now take this in their own hands and know how to protect the ones they love. So there's no right time. The right time is when the country feels they have a certain level of preparedness. And the president today did say it's not 100%, but it is adequate to take the risk.
All right. Are you happy with the way that Kenya has managed the pandemic so far?
Yes and no. I'm in civil society, and one of the things on the yes side, the early closure of borders was very helpful, very, very helpful. Having mandatory quarantine for people who came from outside the country is very helpful. The closure of transport between urban and rural areas, very helpful. But there are areas which you could have done better, and many of them. One is our testing capacity has lagged behind significantly. The second one is that we have tended to lead through law and order instead of community participation, where we have actually witnessed police unleash brutality on individuals because of curfew, unleash brutality on people because of not wearing masks. And that has been detrimental to the response, because the best way to implement government strategies is for government to win the trust of their people. And therefore, one of the failures of the Kenyan response has been to maintain it as a law and order issue instead of a public participation and civil participation issue. So that has been a failure, whereas the early measures were a success.
All right. I want to talk a little bit about the testing, because, I'm comparing South Africa to Kenya, and population-wise, we're more or less the same. I think Kenya is around 54 million, South Africa 59 million, Nairobi population of 4.7 million, Johannesburg 5.7 million. So we're very similar, but the numbers are oceans apart in terms of positive infections. South Africa 197,000 and Kenya only 8,000. How do we account for that?
So there are several factors, I would say. I think the one thing is, of course, if you look at the testing ratios per million, they're also worlds apart. So Kenya is way behind South Africa. South Africa has had a great success in building its testing capacity by doing both public and private. Kenya has done significantly public. So the private capacity has not been utilized, whereas in South Africa, more than 50% of tests are done in the public sector. But then you also must reflect in terms of the affordability, that in South Africa, a big percentage of people are able to afford private healthcare, whereas in Kenya, they are not. And therefore, whereas tests may cost about $80 to $100, very few people can actually afford them in the private sector. So people are taking their tests in the public sector. Number two is a strategy that Kenya has actually maintained a more, trace and test. South Africa has gone out of the facilities and started to do community tracing and testing. But that aside, if you are to equate the testing ratios and say, assuming the testing is at the same level. Mobility is really an important factor in transmission of COVID-19. What is going on, even if you look at countries in Europe and America, is that mobility of people, where you have thousands of people moving from one place to another. If you look at Johannesburg, the level of mobility that is there, the infrastructure, the train, automobiles, the train system, the cars, the flights, the people move in masses, and therefore the transmission is much faster. Remember that also the countries in Africa that got their first introduction of the virus were those that had high international connections. Egypt, South Africa, Morocco. So Kenya is, when you look at mobility, Kenya is a dwarf of South Africa. It's much less than South Africa. So this is contributing to the slow rate of transmission in some of the countries. But that doesn't mean that over time, the numbers will be the same. But they're going to take much longer because the economies are much slower. So this is really the factor that we find that's most prevalent, I think.
All right, so we're starting to see an easing down. America did the same, and we're seeing them backtrack, particularly in the southern states. Is this something that we need to be worried about in Kenya, or do you think that it's been slow and steady?
No, we need to be worried about this. And, I know that we've seen countries in Africa that have opened up and then they are worried, and some areas have had to kind of move back. This always needs to worry us, and this is why, the closure forever is not compatible with a living economy. So you can't close forever until the virus goes away, because the virus won't go away until there's a vaccine, and we don't see a vaccine in Africa specifically in the next 2 years. So closure, long-term closure is not compatible with livelihoods. So they have to open. And therefore, the thing is about balancing the risk versus benefit. So we know that the government will have to be cautious that even as they reopen, there will be surges in infections. The question is to ask whether those surges in infection are accompanied with surges in mortality or death. So that is really where the problem is. The problem is not in the number of cases registered. You can register 1 million cases, but if the deaths are 0, then you're fine. The cases don't mean anything because it is a virus going to pass on. The challenge is how many people require critical care, how many people may pass on. And therefore, when you see deaths or critical care rising, the government may have to lock down specific areas where these are coming through. So we will see that in the next 1 year. We think that this is going to be a smoldering pandemic, which is not going to go away in a long time. Keep closing, disappear, come back, and we have to be prepared for that.
All right. I see one of the concessions that have been allowed is people around to go back to church. And when we think of South Korea, it was a church that caused all the problems in one of the major cities there. They have limited it to 100 worshippers at a time. Is there a science behind that number? Because if you go to another country, they say 50. Kenya's chosen 100. Is there a rational, scientific way to get to the number 100?
Well, actually, the number 100, if you ask me, as a public health person, I would say it's actually a number that you can't use because it's supposed to be dependent on the space available. It's supposed to be dependent on how far an individual can be from the other. Remember that we say, do the following. 1, avoid close contact, meaning you keep distance away. Secondly, wear masks to avoid, aerosol contact. And third, avoid closed spaces, because we know that closed spaces increase the chance of transmission. Now, when you talk about a number, if you have a church that is the size of a stadium with 100 people versus a church the size of a bedroom with 100 people, then you see that therefore there is actually no logic in using numbers. What people should use and what we advise for them to use and governments to use is to say, this is the distance you must maintain between one person and the other. Then based on your ability, then decide how many people that you can accommodate if everyone is at least 2 meters away from each other. But numbers are actually unusable, I would say. Somebody told me the other day, you can allow a church to have 15 people, but it's so small that at 15, some people are already outside. It's full.
Yes.
So what does it mean? So it's about distance.
Perhaps finally, the issue of compliance with regulations, wearing masks and social distancing. How are Kenyans with that? Have they been complying generally? We've struggled here in our country. Many parts of our bigger cities, people don't seem to be doing these things. And the fear, of course, is that this pandemic will just continue if we don't do the right things.
Yeah, the measures that our people are supposed to take have been the implementation or the obedience, or the people complying with them have been kind of varied, far and wide. We know that people are avoiding contact where possible. We see that. But some of the areas, and people are hand washing, but the things that result in personal inconvenience, like staying at home when you need to go look for food, or wearing a mask and we know that it's uncomfortable, those we have seen that people have resisted, or people have done it largely because it's a law and order issue and there's a policeman in the corner. But it has not been the same as we desire. So people are not following the instructions in terms of wearing masks, in terms of staying at home. We know for staying home, there is a livelihood question, but there's also an issue of lack of understanding, which goes back to what I said earlier, that people need to understand why they're doing the things they're doing. There are many people across Africa who still believe that COVID doesn't exist, and therefore they're doing what they're doing for government. There are many people who believe that the governments are doing these things for the purpose of receiving money from donors. And therefore, the lack of trust in government strategies is part of the reason why we are seeing such low compliance. So as we reopen, the most important factor for governments is actually to move to the next stage, which is community engagement and mobilization of people and citizens, for people to understand that the reason for wearing a mask is to save the life of my mother.
Okay, and that's where we'll leave it. Thank you so much indeed for joining us and sharing your insights with us. Asante sana.
Asante sana. Thank you. Thank you for inviting me.